for taking the time to learn what your role might be in the event of an emergency. There are two key terms you'll need to know. The first is an SNS, which is the Strategic National Stockpile, where large quantities of medicine and medical supplies are stored in the event of a public health emergency. POD is a mechanism for dispensing that medication and medical supplies to the public. These pods will be placed in a centralized location and activated if there is a bioterrorism event, a natural disaster, an infectious disease outbreak, or a radiological exposure. In the event of one of these emergencies, volunteers would be asked to report to a local pod where their efforts are crucial to maintaining a quick and efficient movement. In fact, under federal requirements, all medication must be distributed to residents within 48 hours of the decision to do it. So, part of your job as a volunteer is to keep this pod moving. When people first arrive at the pod, they're going to be given a form. Step 1 is to fill that form out. They'll wait in line, and step 2, they're going to show that form to the triage people. This is where they'll talk about if they're experiencing any symptoms or anything like that. If they're cleared to go, then the next step is step 3, picking up their medication. This is where you'll get as many people as possible their medication and then head them out the door, which is step 4, turn in any remaining forms and exit. Every position in a pod has a job action sheet. These sheets tell you who your supervisor is, what you need to do when you first arrive, what your overall duties will be, and what you need to make sure you do before you leave. All volunteers will be given personal protective equipment as needed and medication for them and their families prior to the event. Thank you for your attention and good luck. All right, guys, let's get started.
Oh, I cannot wait.
It's going to be so much fun.
Oh my gosh, I'm so glad we're going.
It's going to be so awesome.
Crazy left arm.
Great.
Here,
Left
I'll be
arm. You have a
super
left
smart.
arm?